This is the Iowa Online Nurse Residency Program's Resident Spotlight. Hosted by Program Coordinator Jess Osipka, today's featured guest is registered nurse Annika McMillen from Ridgeview Medical Center in Minnesota. Annika is part of the July 2024 residency cohort.
Today we have a current nurse resident, Annika, with us to chat about her experience in the program. So Annika, do you just want to give us a little intro to yourself?
Yeah, I'd love to. So, like just said, my name is Annika. I have worked as a nurse for just over a year now. I work on an orthopedic surgical floor, and that's where I've been for my first year as a nurse. The hospital I work on it's not super big. It's kind of more of a rural hospital, but my unit has 17 beds, so I feel like it was a good place for me to start.
Can you talk a little bit about how you've applied the concepts that we talked about in the residency program to your area of work?
I would say the way that I've done that is every month we are asked 4 questions, and then we kind of answer those in a big discussion with everyone in the program or in our little cohort. And I feel like that has been the way that I have been able to apply the concepts into my practice, either through I'll read the questions that were being asked, and I'll reflect on how those questions apply to the things that I've worked on or seen in my practices, or they allow me to think, how can I change moving forward? How can I use these questions moving forward into my work?
That's so great to hear. How you're spending all the time thinking about what you're currently doing, maybe what could you be doing a little bit different based on some question prompts. I really appreciate that. Can you talk a little bit about your professional experience, what you're working on in that process?
My professional project is on the importance of debriefing after rapid responses or codes of any sort. And I was kind of inspired to do that based on some rapid responses that I have been a part of and that I've led. And I don't feel like I had the opportunity to have a debrief with myself or with my coworkers. And that's something that I find really important. So I want to make a change in my facility so that can be used for myself and then also just for my other coworkers. I want it to just be a place where everyone feels heard and has time to reflect on experiences that can be really traumatic.
I love that topic so much. It's a scary thing, regardless of how much experience you have, when your patient decompensates and you need to call a rapid response or even a code. So I think creating that space for your team to learn and grow and just decompress after a situation like that is so important. So I love your idea so much. And I can't wait to hear how it continues to evolve as you're sort of wrapping up your residency program, but what kind of happens with that idea in the future too? And what a powerful way to make a change within your organization, your team, your patients. That's such a powerful change that you're making. What aspects of the program you found most beneficial for your day-to-day practice or outside of clinical work?
I mean, there's been a lot of benefits. First, just at the beginning of the program, it's daunting going into your first nursing job or whatever that may be, coming fresh out of school. So it was nice to have just a sense of community and feeling like you're not alone in the many challenges you face starting your nursing career. It's an exciting time for sure, but it can be scary. It can be overwhelming. So it was nice to just have a place to feel heard and feel like, okay, I'm validated and I'm not the only one not the only one facing these things. But also the things that we talk about, I feel like each month I was able to apply to what I was doing in my work. And then also having the project to just kind of be a little detective at work too. What can be done different at work? How can I make work better? It's challenging, but I think it allows you to grow and see things in a different way and then try to fix them.
I love that. You gave me goosebumps. I think it can be so easy to get wrapped up in the things that aren't going well, but I love that you just said sort of that, I don't know, that detective work, how can I make it better? So instead of maybe just kind of complaining about it, working to see what we can find for a solution.
Yeah.
Yeah, I think that's great.
Mhm.
Which is hard. I know it's hard. And sometimes the solution's pretty clear and sometimes not so much. So I like the analogy to being a detective.
Mhm.
Is there anything that you would like to share with current or future residents?
Yeah. There's a few things. If you're a new nurse, I just want to encourage you that don't be super overwhelmed at the beginning. Things will be better and give yourself grace. I think that's the thing that was the hardest for me, was just being too hard on myself. Like, it's okay not to know things. It's okay to ask questions because that's how you grow. Also, just with the residency program, I think the work you put in is the work you get out. So put in the work and you will have great outcomes. Challenge yourself and you got this.
Thanks so much, Annika. Thanks for visiting with us and thanks for sharing your words of advice for future residents. I think encouragement is great. The cohorts are great. It does. We want to create a space that makes you feel like you're not alone in the things that you're experiencing, especially if you're the only new grad in your organization, maybe, or on your unit. We want you to know that those things that you're feeling, you're not alone. Those experiences you're having, you're not alone. So I appreciate you sharing all that. Thanks so much.